Hello, I'm Dr. Anil Goody. I'm a consultant in reproductive medicine, surgery, and assisted conception. And today again, I'm going to talk on a very small topic, and that is basically looking at estradiol levels in poor responders before ovulation. And why is that important? Now, which is the commonest test that we do during stimulation? And it's estrogen levels. And estradiol levels are measured almost regularly. And in fact, a lot of our modifications of stimulation and increasing the dose of drugs or giving lesser drugs or increasing gonadotropins is all based on looking at estrogen levels. And so where does estrogen come from? From the glandular cells. So what is it telling us? To a large extent, it's telling us about how the follicles are growing. It doesn't tell us about eggs though. It tells us about follicles growing. And that's important to realize. So, and this was a paper which was done in 2006, published in Fertility Sterility and from a clinic in New York. And what they did is they looked at poor responder patients. And see, the very unique thing is that in poor responder patients, you will always see slightly lower estrogen levels. And I think that's because of the competency of granular cells. And I think as women age or as the egg count starts declining, probably the worst types of eggs start coming out. And I'm not saying there's some evidence at that. And probably also what's probably happening is that the quality of granular cell and its initiation and also tends to start worsening. And I think that's probably because you start seeing a lower E2 levels in many of the poor responders. So what does this group do? And what they wanted to know is what happens when estrogen levels drop before HCG and after HCG trigger. And so they did an estrogen levels HCG minus 1 day, HCG day, and HCG plus 1 day. And they looked at 252 cycles. And they looked at just before trigger, if your estrogen levels drop, there didn't seem to be a huge change in the number of oocytes, but the clinical pregnancy rates tended to drop from 9.1%. And when the estrogen rose, the clinical pregnancy rate went up to 27.8%. So clearly, there seems to be some dramatic problem that seems to occur with that drop of estrogen. And we don't know whether that is leading to an endometrial damage or it is creating a worse type of embryos. And it's very difficult to know that. Now, the second thing which was done was they said what happens on the day of HCG trigger to the day after. And if your estrogen levels dropped, unlike that of if the estrogen levels dropped before, and if they dropped before the day of HCG, in fact, there was no difference in the number of oocytes. But if it dropped after HCG, then the number of oocytes also decreased. And I reckon that what's happening is that certain amount of follicles are luteinized rather than rupturing. But also what we ended up seeing is you saw fewer number of oocytes, and again, if your estrogen levels dropped, and I think the competency of oocytes is to be questioned. But pregnancy rates tended to remain slightly different. So 13.4% in the estrogen level fell and the clinical pregnancy rate of 27.8% if the estrogen levels rose. So what do we learn from this and why is it important? It's important because from a clinical perspective, and it's important because what we are going to tell these patients. And in fact, what are we going to infer from the treatment that is done? So if you think that estrogen levels are going to drop before, I think we are safe enough to say that your pregnancy rate is also probably going to go down because there is some luteinization occurring and the follicles are giving way. But if your estrogen levels drop on a day after, on a day of HCG trigger, we're also looking at probably getting fewer eggs or getting less mature eggs and probably a slight reduction in pregnancy rates. And I think the reason I picked up this talk, slightly older talk, almost 10 years ago, is there are very few talks which have been looked at estrogen and looked at how the estrogen levels vary. And that's something which is extremely important. Thank you very much.